Okay, now.
Okay. So we would like to introduce Yeet and the Leer Foundation within this workshop. But maybe I would leave Yeet himself to introduce you and the half of what we can see. Okay. So brief introduction, please, of the foundation and the work you're doing, as well as the Urban 95 scope. Okay.
Yiğit'i duyamıyoruz. But we can't hear you. No, still we don't hear you.
Can you hear now?
YouTube. Oh yeah, okay. We are on you.
Okay. So there are 5 people here actually from the Bernard Van Leer Foundation. And that's a nice coincidence that we have this office meeting in the Netherlands once a year. I'll leave the floor first to Program Director Cecilia Baca-Jones to tell a bit about the foundation. And then we'll have Ardan telling a bit about the Urban 95. And I'll tell more about Istanbul 95. So we're going to do it quickly to leave space for your questions, yeah?
Well, thank you very much, and good afternoon to you all. And it's a pleasure to be part of this conversation. I'm Cecilia Baca. I'm the program director from the Bernard Van Leer Foundation. And I think what's important for you to know about the Bernard Van Leer Foundation is that we've been working in early childhood development for over 50 years in over 50 different countries around the world. And when I'm talking about early childhood development, I think that the important thing to know is that what we're trying to do through our different programs and policies, working with governments at a national level or at a local level, is to try to support the policy making and just trying to understand the cross-sectorial work in early childhood development. And when I'm talking about cross-sectorial work, I'm trying to think on how you can develop early childhood development programs from a nutritional perspective, a health perspective, a social welfare perspective, and of course an educational perspective, and trying to integrate this cross-sectorial focus on early childhood development. I think that's a very general view of what we do, but what I think I like about working with the Bernard Van Leer Foundation is that what we work for is to try to improve the conditions in which children live, and we try to promote a fair start for all children. And I think that's what commits all of us to do our work, and that's part of what we're trying to do in different cities around the world. And I'm sure that Yeet and Arden will tell you more about what we're doing in the urban development, but we do think that in order to make the integrated early childhood development work, we need to think about the context where children develop. And it's very important to understand where our children are growing and how our cities are helping thrive their lives.
So then Ardan can tell a bit about the Urban 95.
Yes, of course. A few years ago, we were looking at our portfolio of all the things we were doing, and we were looking for the best ideas that would reach the largest number of children and parents around the world, and that would be applicable everywhere. And one of these things was the living conditions in cities for families and children. Since the enormous growth rate in cities and urbanization, there's numerous and large number of children growing up in city environments where there are large challenges, but at the same time also enormous opportunities to reach a large number of children with services and better living conditions. We try to improve the living conditions in cities by several means, primarily by working directly with city governments. We want to have the buy-in and interest of the government in cities together try and test out concepts that can improve these living conditions. We of course recognize the importance of working with the local population and having the interest and taking into account the needs. But if there's no interest from the governance level to do things, you will never really quickly get a large scale and reach a large number of people. On the other hand, we're trying to bring the whole concept of children and their needs and families who are living everywhere in the city into the global dialogue in general about living in cities as a primary way of looking at cities and the urban environment. And next to it, we're funding small-scale programs and projects just to see what are the most innovative ideas around the world to get ideas and bring them into practice and see from all cities in the world what we can do there. The primary program is the Pioneering Cities, what I said. That's where we're working with large cities around the world to test these ideas. Cities like Istanbul, cities like Tirana, but also cities in India or Israel and Latin America. We're working with government to test these ideas. We're looking at ideas in certain areas where we think we can reach most people. And that is improvements in the areas of public spaces. So green spaces where people have the time and rest and the means to spend time and interact with their children and their families. Improve mobility, because daily travel in cities is of enormous, can lead to enormous stress and a reduction of time that parents can spend with their children. We see that in cities, often there are different departments that are not always collaborating well and not always collecting data in a way that informs their decision making in a way that they see what the most challenges are or most challenging issues are in the city. So we promote that collaboration there. And lastly, we're looking at how cities and what service cities provide to parents in the city. So thinking about childcare and education, but also other services that parents might need, or information that they could use about the importance of interacting with their children, reading to their children. So that's a quick overall view of the different sort of things that we're trying to achieve. And just give the floor to Yi to just tell a bit more about the work in Istanbul.
Yeah, I just want to go back one step and talk a bit from your language, actually. I think you're all architect students or actual architects. Yes or no? If you can just raise hands. Yes. Okay. Perfect. Think about a building where 85% of it is already done and you're given the job to restructure it. It's nearly impossible. So therefore, we are investing in early childhood because the brain is developed in the first 3 years and 85% of it is almost done in the first 3 years. So that's why we are heavily investing for 50 years in early childhood. And now we know that more than 80% of the kids or of the population in Turkey, at least, are born in urban settings. So these two issues are combined in Urban 95 strategy in a way that to receive more return on our investment. It's proven that if we invest every invested $1 returns around $7 to $10 in early childhood. So this is one of the best investment areas as well. The 95 comes from the 95 centimeters, which is the average height of a 3-year-old. So we're asking decision makers, urban planners, and architects, what would you do differently if you look at the city, at your work, from 95 centimeters, from the average height of a 3-year-old? Yeah. So would you do the steps differently, the doors differently, even the chairs and tables differently? But if you think the urban setting, it's even in a larger context, and think about the buses in Istanbul, transportation in Istanbul and all this stuff. So our work is focused on the 3 components of Urban 95 in Istanbul. One is parent support. We are developing with 4 district municipalities. Who's living in Istanbul from the crowd? Can I see hands again? 1, 2, 3. Okay, for those living in Istanbul, we're working with Beyoğlu, Sultanbeyli, Sarıyer, and Maltepe municipalities, and we are developing pilot programs with them. One is focused on parent support, which is home visitation service, not in your area, I know. The other one is data-driven decision making. We have developed poverty and child density maps of on neighborhood basis of all Istanbul, which is online. It's on belediye.istanbul95.org. I'll send you the link by typing after I finish. You can check where the most disadvantaged. Perfect, thank you. You can check where the most disadvantaged children are in Istanbul and what municipal services they are able to reach or access or not. And the last bit is the part where we are collaborating with Superpool and Studio X and Kadir Has University, is where we develop green public spaces for young children especially. Why young children? Because they develop the most physically and cognitively, but the parks, the green spaces are not mostly designed for them, but for older kids. The lowest age you can get to a playground is around 5, and the most need is on the 0 to 3 group. So not only the children, but also the mothers also need to go outside to have better time to socialize with other mothers and also to relax a little bit and have good time with their kids. So that's why we're investing into that, and we hope to develop at least 4 pilot playgrounds, public spaces with Superpool appropriate for young children and their parents. I think that's quickly what I would like to say. I will give the floor a little bit to Julian, who is sitting here, who can tell a little bit more from the urban planning perspective, what is the research going on around the world that we are supporting. No? Thank you.
Absolutely. So, hi everyone, I'm Julien. So I work also at the Urban 95 initiative at the Bernard Van Leer Foundation, and just wanted to share very quickly a bit how we're trying to build that bridge between the urban planning and architecture world, which is very specific to early childhood development, which has little link or has had little link in the past. So as Arden mentioned, and Yiğit in his explanation of Istanbul projects mentioned, there's several categories we're looking at, like public space and green space. Mobility is also a big one that we're still kind of figure it out at the moment, and data-driven management and parent coaching. But one of the most important things that we learned is that because you can't really ask babies and toddlers how they experience the city so well, it's very important when you're an architect or a planner to look at the city as experienced by the caregivers, so the parents, or anyone who takes care of the children, whether grandparents, parents, or anyone else. So it's very interesting to plan not only 95-centimeter perspective for the very young kids, and the way, for example, when you come to mobility, it's actually more important to plan for the mothers moving around with a stroller, or thinking how their routes and destinations are planned out so that they know, so that it's easier for them to predict their routes and get to childcare and healthcare and their groceries and all the things they need to do for themselves and for the babies. It's also important to think about when planning a public space or service, how they're going to feel, and also thinking more long-term or maybe comprehensively about their mental health and their well-being. So these are little points that can expand the discussion about thinking about babies and toddlers and when planning and designing that we have not figured out all the details of, but that's where we're at, and that's where we're focusing at the moment.
This is more or less what we would like to present. So if you have any questions, let's go on to that. Yeah, quickly.
Okay. Thank you very much. It was very impressive to hear you guys talk as usual. Now we have actually asked the students in Venice to think about the future of childhood, right? So not today or maybe the next year, but sort of the future in a larger scope. What's the future of the foundation's work? Yiğit, maybe. I don't know. Maybe you start. Or Cecilia, whoever picks it up.
Well, I think we probably think that currently the two big areas.
The sound is a little bit low now. I don't know what happened.
You're here now?
Yeah. Yeah.
Yeah, I think. Yes. So I think we're currently working on two key aspects of early childhood development. The first one has to do with parent coaching programs, mostly at a national level, helping improve parenting coaching programs in many different countries. And the other part of our strategy is focusing on Urban 95 and trying to help cities develop strong urban policies and also to help urban planners, architects, or anyone who's dealing with the development of the cities. And I think thinking on the future, I think this will be our main area of investment, just because the whole world is, there's a big trend of urbanizing the whole world. So if we think 20 years from now, the urban population will be even bigger than what it's now. So I think that the challenges that we're going to have are going to be even bigger than we currently see. So I think that what we're currently doing is going to be helping future cities to become thriving cities for the rest of the world. Um, uh, that's my perspective. Actually, this week we're meeting the whole team because we really want to make the effort to think not only about our current objectives, but also about our future objectives. And I think a big part of our future strategy is going to be centered in the well-being of children in the future cities of the world. And when I'm talking about the cities, I'm not only talking about urban planning, but also, for example, about air quality, pollution, access to healthy food. I think there are many aspects that come along with urbanization that are going to be very important in the future.
Okay. Yeah, then for future Istanbul.
We would love to work with ministries and metropolitan municipalities. Actually, there's a lot we can do, and we're trying our best to do it with district municipalities. I think it's a good way to show cases, good examples. But we are willing to engage metropolitan municipalities and ministries in the long term. Yeah, also the private sector if possible.
Thank you. Maybe if there's any questions from Venice, I think it's important to take note of that. Of course, it's not the investment the foundation is doing now, as they're saying, is not only for today, right? So I think it's plus let's say the population of children is a constant population, right? It's not a population that goes away. That's our own personal feeling. But the fact is that there's constantly a population of up to a third of a city that is children. But that population is really underrepresented even today. So how would that population be 20 years from now?
So, question to us or them? And you're not.
Yeah. Any questions? Or you?
Maybe I have a question actually.
Okay.
Thank you so much for sharing this information with us. I'm sure we're gonna use a lot of it in our process. And I was wondering, since you mentioned that you were working very closely with local municipalities, I'm curious about the sort of time frame of the projects, in the sense that I imagine there would be lots of bureaucracy related to it. And how does that work? Like, is it a fast process or a much longer one? And following up on that, what difference would it make to work with the private sector as opposed to the municipalities? I'm just curious about the general process.
I mean, the way we see the work with municipalities is a long-term commitment, and of course, we're going to start with a short-term commitment. In case of India, we have programs for 2 years, but it works very differently in every city that we're currently working. For example, we are currently working in Sao Paulo, Recife in Brazil. We're also working in Bogotá in Colombia, Lima and Piura in Peru. We're working in Tirana, we're working in Amsterdam. So depending on the history of work that we have with each of the cities, we have different time commitments. Why do we work with municipalities? Is because we want to have a sustainable change in the cities. So if you're able to influence policymakers, and I'm not just talking about influencing mayors that have a responsibility for a specific period of time, but if you're able to influence policymakers that can sustain important policy changes at a city level, this would be sustained in the long term. This doesn't mean that we're not working with the private sector. And I think even in the case of Istanbul, we have a first agreement with the municipalities and the different district municipalities of Istanbul. But the idea is that we can add value, inviting other key stakeholders to work together with the municipality. So every municipality has the responsibility of doing the master planning of the city. And when we're thinking about a child and children in general moving around the city, we got to think about the master planning of the city and how can we add private efforts in order to improve the conditions of these cities. And there's where, for example, your work as architect can be very valuable on giving innovative ideas on how to make the city become an exciting city to live and learn. And I think that's what's interesting for us. Usually when you think about people who have been working in early childhood development, we've always been involved with people that are closely related to the educational sector or the nutritional sector or the social welfare sector or maybe the health sector. But we hardly ever thought about working with professionals linked to the urban sector. And I think that what we're trying to do now is trying to work with you guys, trying to make you see the responsibility that you have as architects when you're designing different things. And I'm thinking from a different perspective that you might have as a professional. It's from the building a house or a building, as it was given the example of the foundations of housing in general. But I'm also thinking about the work that architects have to do with improving the public space or in making streets, for example, which is also one of the biggest public spaces that we have in the cities usually. And we never really think, how can we make streets become a friendly space for children? We usually think of streets for cars and we don't think of streets for children. So I think there are many different contributions that professionals like architects or engineers or environmentalists can think of as innovative solutions that can improve the life of children and of course of caregivers. And we believe that if we are able to change this for children, this is going to be good for any other generation. Whatever is good for a baby, it's definitely going to be good for an adult and an elderly or a disabled person. So I think this is the other very important thing that we're trying to send as a strong message.
I think this is exactly what we wanted to hear from you. So I think we'll end it here and let you guys go back to work. Unless there's more questions from Venice.
One more.
There's one more question. Okay.
Okay. Before, when I checked your website before, and for who are not familiar with it, when you click the place, there is a list of the facilities that provides anything to children. I wonder how did you choose the criteria, because there are different things for the health and for the playgrounds. So why did you choose those? Yeah, you got it.
The mapping now that you're asking. Yes. Okay. So we have targeted services available for children 0 to 8 group and their parents actually. So we didn't go on for the whole population or all children from 0 to 18, but mostly targeting 0 to 8 and their parents. Yeah. So that's why there are daycare services, health services, psychological counseling services, and parks, as far as I remember. Yeah. This is one, and these are only focusing on municipal services, district municipality services. This year, we are going to add central government services like health, education, and metropolitan municipality services on top of that. Then we will be able to see what services in some mostly disadvantaged neighborhoods are able to access and which are not accessible actually. Yeah.
And the main reason why we choose these sectors is because, as I was saying at the beginning, when you think about early childhood development, you're going to see an integrated approach of early childhood development. So you have to be able to put together educational services, health services, nutritional services, and social welfare services. That's And now they recently, and I think that there was even like a launch in Turkey of the nurturing care, which is a way of trying to put this integrated approach of seeing early childhood development. So you cannot think of a young child or of a baby just from a health perspective. You have to put together all these different perspectives in order to have an integrated approach of this little human being that needs to have all of these different commodities in order to have a good development.
We can answer one more question. I think we have time, so don't worry. Yeah.
Okay.
Can you hear me? My question is regarding the output or the outcome of a project in which you are involved for a time, and then afterwards it should somehow continue living in the hands of the municipality and in the hands of the local community. And I was wondering how this transition works as a first part question. And the second one, how to measure the outcome if the scale in which you're working is basically the lifetime of a children. Like, how can you assure that knowledge and learning from this singular project runs back into fertilizing new projects? Thank you.
Or if you want to, I have some ideas there, because one of the main purposes that we have is to have an impact at scale, and this and the way that we measure that we have been effective and efficient in achieving scaling and sustainable processes are three main things. The first one has to be how were we able to institutionalize a process? Let's say, for example, in the case of Turkey, are we going to be able to have the municipalities use the maps that we have developed and the data that we have developed in order to help decision makers make better decisions on the municipality? And this would be a way that we can reinforce the institutionalization of many of the tools that we develop. Another thing to measure how sustainable this can be is what I was saying before. Are we able to develop any specific policies that can set, for example, guidelines that can promote the master planning of a city that can have a child perspective? And this is easy to see, and we are already seeing this in some of the cities that we're currently working. And just to give you an example, Recife, which is a big city in Brazil, in the north and east part of Brazil, launched an early childhood development policy last week at a municipal level. And this policy has like very specific guidelines of the different responsibilities of each of the sectors working at the municipality, and some very specific guidelines of innovation that they can do at a city level in order to improve the urban development of the city. And the third thing that we usually consider in order to see our impact for sustainability is to see if any municipality has been able to leverage the investment that they put specifically on issues related to early childhood development. So these are the three things that we usually see whenever we partner municipalities, is to make sure that the outputs and the outcomes reach this kind of impact. Maybe you want to add anything? Or?
I mean, yeah, we use a rigorous measurement system as well. So we have now we'll have 480 families in our intervention group, and there will be a control group. The measurement methodology is developed by Boğaziçi University and implemented by a field research company. So the university will evaluate the findings, which is based on child outcomes, child development outcomes, language development, but also parent-child interaction. We are looking forward to develop a way to measure the efficiency of the parks that we will be developing with the Superpool, actually, whether the frequency of use is increased, whether the time spent in these parks is increased, whether the mothers are feeling much better after using these parks, whether we can see any change in the child development and so on because of use of these parks, and on the scale, whether we see municipalities adapting these new methodologies now and replicate similar parks in other parts of the municipality. So these are our kind of indicators, yeah.
Excellent. More questions from Dennis?
Guys?
Actually, I have another question. Sorry.
Okay.
I was wondering, was there something which sounded really smart and feasible and didn't work out in contrast to all expectations? Something that is just not advisable?
We can't hear.
I mean, it usually doesn't function when we do things for them, for the municipalities and so on. No? So it becomes a challenge to make it part of their work. So, I mean, it didn't function, but we're still seeking our way. The maps were a very good idea to analyze the income through property tax, property prices. Was a very good idea. To put the services of the municipalities was a very good idea. But if they don't own it, these maps will not survive, will not, be sustained. So but this is valid for all kind of work. Yeah, we can develop design, very good designs for municipalities, and if they don't own it and replicate it, it's gonna stay with this one design. So this is my answer. I don't know if you have any other.
I think we're still trying out different implementation projects. So I think it's a very good question, and we're very open to learn about what works and what doesn't work. What we've realized so far, for example, on public space, that at the beginning we had more an idea. For example, we started working in India, and we started working with the idea that what we needed was to create more open green playgrounds, and then we realized it was not only about playgrounds but about public space, because in a country such as India, there's little public space. I mean, it would be very difficult to have like large playgrounds. So we were talking about more like small spaces and how you can make more dynamic public space in very small spaces. So I think that has been an important learning, like coming to this idea of just like taking advantage of any public space that we can find in a neighborhood that can actually become a friendly space for young children. So I think there are a bunch of ideas that have switched, and I think that what we have learned so far is that it's very important to have an integrated way of seeing things, because again, India, which was the first country and cities where we started, we had very isolated interventions, and we realized that it's very important to have integrated interventions. So we could see public space together with mobility, together with the connection of other services, together with data. And for me, one of the most important things that we haven't mentioned, it's also very important to involve people and caregivers and the participation of citizens, because at the end of the day, the best way to succeed and to have people being empowered of this kind of policy has to do if people are convinced that they want to have cities where children can walk freely around the city. So it's, I think this has been an important learning. This is not something that you can just run from top to down, but it's also something that has to go from down to top with the empowerment of citizens and with the participation of citizens on how they want to design their public space and their public life.
We have Ardan to comment, and then Julian wants to comment.
Yes, I think what Yeet also just started with. It's very important when we're working with municipal governments, that they own the knowledge and the information, but also, for example, the data system. So if they don't have the knowledge or infrastructure in-house, often they hire it from companies or consultancies. But what ends up is that the government is paying these external companies structurally for something that they're using and actually don't own the data that they're collecting themselves, which makes them dependent on the long run and often doesn't give them the knowledge in the long run situation that they need. Another is what we've seen quite often is that when we're talking about the needs of kids, that many organizations and also governments explicitly think about the kids that have a need to roam freely. So it's often about children who can use the outdoor space themselves to investigate and explore. what often gets overlooked is these very youngest children that are under 3. It's the most important part of life in terms of the brain development, where structural growth takes place that can be bettered when not done in those first 3 years. But these children are not independent; they are dependent on the parents. So it's really important to look at the parent and their needs, and also the mother or the caregiver. So also a sense of gender and how mothers and women use public transport and space, which is different from when men comes into play in these kinds of approaches.
Okay. And finally, very quickly, I want to mention that we're still testing out some very specific ideas. We have a document out right now called the Urban 95 Starter Kit, which lists 29 ideas. They can be design intervention, management intervention, and they go from very simple, such as closing streets for kids to play, to crossing safer street crossings, or all these kinds of quite detailed and small interventions. And this document that you can find on our website is a test. So we've spread it around some of our partners, which are implementers of programs around our cities, and they'll get back to us in September, October, around that, with actually what they thought was working well, what's working well about the document, but also if there's any of these ideas, interventions that we're proposing, that we're exploring, that actually do not work at all. So to answer your question, initial question, I think we're still trying to figure some of this out. And that's one of the examples of how we're doing it very specifically in the field. And of course, we also rely a lot on all the actual architects and urban planners that we work with on the field, because we are not. So this is an example of how we're doing this. And you can find it online on our website if you want to take a look at these 29 ideas that we have so far in this first version.
All right. Yeah, we have looked at the starter kit and it looks promising. So you will hear our comments.
Okay.
Is that it, or more questions?
I think let's end it at this because we need time to work.
Okay. Okay.
Thank you very much, by the way.
Yeah. Thank you very much, everyone up there.
I want to thank you. I want to say thank you for this class and having space for childhood in your career, professional work, educational life. I'd like to say thank you to my colleagues, but I'd like to say thank you to Gregers and Selva for being so brave in putting childhood in their agenda, in their professional work, and in their life, like professionally and personally. I know they're 2 kids and everything, but it's a brave move to take this issue on their agenda and to proceed with it. So thank you all. Yeah.
Thank you very much.
Thank you.
We are great.
Ciao.
Goodbye. Thank you.
Hey, stay. What? Let's just hang out for a second. You guys can go.
Okay, we will.
All right.
Okay, I will stop the on-air part and I will call you hangout, okay?
Okay. Yeah. Nice.
Okay.